Okay, so today we will discuss how to report a lumbar spine. Now, the first image which we should see in a lumbar spine is the scanogram image or the whole what's called the pasted image, multiple names to the basically the entire vertebra should be seen so that we can do numbering and so that we can check for lumbarization or sacralization. So we start counting from here. This is the C2, C1 and C with dents, the C2. C2, 3, 4, 5, 6, 7 cervical vertebrae, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12 thoracic, and 1, 2, 3, 4, 5. We can see that the fifth, the L5 vertebra is here. It doesn't look sacralized. It's got a good shape to it. The intervertebral disc spaces and the intervertebral discs look normal in size compared to the prior ones. So if there's a sacralization, it will look more like this vertebra, and if there's a lumbarization of S1, then the S1 will look more like the lumbar vertebra. So we can see that the L5 doesn't look like anything of that sort. So it looks good. So there's no lumbarization or sacralization. The next thing we see in these scanogram images is to look for any soft tissue abnormality. Make sure you look at the brain, the eyes, the nose, the mouth, the paranasal sinuses, the thyroid. Sometimes there's a thyroid carcinoma and we might miss it. Have a look at the chest organs and the abdominal organs. Sometimes you can see, especially if in women, you can see some pathology here like a uterine fibroid or an ovarian mass. All that can be seen in this. Then we go up and we can see that the tech has also provided some cervical images, and we can always have a look for all the additional images given, and we can see that there is straightening or loss of cervical lordosis, and there is disc desiccation, and we can see all the discs are appearing hypo-intense, and that means they are loss of hydration and there's undergone dehydration. This is called desiccations, and multiple words to say the same thing. We look at the cervicomedullary junction. We look at these, like there are tiny disc bulges here, uh, which are indenting the thecal sac, and but this is a lumbar spine study, so without much ado, we will go into lumbar spine soon. We have a quick look at the dorsal vertebra. Again, there's disc desiccation. Look at the discs here; they are so dark, and look at the disc here; they're so much better appearing, slightly hyper intense, and this is how a normal disc should look compared to what is showing above. So the upper dorsal discs are desiccated, where the lower ones look sort of okay, not the greatest, but definitely better than the upper dorsal. And then make sure you look at the sternum and the heart in these images. And now we go to the lumbar. We have a quick look at the lumbar. We can see that there are some corner lesions here which are hyper intense, and on these T2 images we can see that the conus is terminating at 5, 4, 3, 2, 1 at L1-2 level. Make sure you always see that. Make sure that the thecal sac is not too down below into the sacrum, and then make sure the phylum terminale, the chorda equinae, everything looks good. There's no tethering of the cord, and we can see that there is mild amount of desiccation here, lesser than the cervical, but definitely still there. And now what we're gonna do is we're gonna see the T1 weighted images, and we can see that these are again hyper intense, so likely of fatty origin. And then in T1 weighted images, we look for any marrow signal abnormalities. We see that the rest of the marrow signal looks fine. And then we can see the coronal images, and in coronal, make sure you look at the sacroiliac joints, and that's what it's done primarily for. So we can see that the sacroiliac joints are a little, well, there are some amount of subarticular erosions and irregularities. There is reduced joint space, but there's no joint effusion. There is some amount of there's definitely hypointensity in these joints with some amount of, these are stir images. We can see that the fat suppressed, so these areas might have been hyperintense on T2, which are appearing hypointense, so likely fat suppressed areas. So probably some amount of chronic sacroiliitis going on, but however, definitely no marrow edema, no acute sacroiliitis here for sure. We do look for the liver and renal anomalies sometimes, and splenic anomalies. Sometimes we get to see those in coronal images. And then we will now go to the axial images. I always compare axial with the sagittals. So this is how I'm going to do it. You can also use stir images for them. Yeah, stir images will show you fat suppression, and we can see that these areas have become fat suppressed. Definitely fatty degenerative changes. And now, uh, since this is not coming up as marker points, we will take probably T2 weighted images and the axial images. Okay, now it's coming up. Okay, yeah. So we are starting where from 5, 4, 3, 2, 1, D12L1. We can see that the thecal sac looks good, round, oval. The exiting foramina look well spaced. There's no disc bulge compressing the thecal sac or the exiting nerve roots. So this looks fine. There's no disc bulge. Next one, again similar appearance, no disc bulge. Again similar appearance, no disc bulge. Now here also, well, I can see that there is subtle, it's abutting there is mild amount of disc, posterior disc bulge, which is causing abutting the thecal sac, but the exiting foramina look great. So there's actually not much happening here, just mild disc bulge abutting the thecal sac. And here we can see that there is mild compression of the thecal sac and the exiting foramina, and compared to the previous disk space. And here again we can see that there is nothing, there's plenty of space here, there's no disc bulge. So except for at L4-5 there's mild disc bulge, mildly compressing the thecal sac and the neural foramina, and the L3-4 just abutting the thecal sac without any actual neural compression. The rest of the discs, there are no disc bulges. So the report will be that there is loss of lumbar lordosis, there is disc desiccation, and there is just mild posterior disc bulge at this level and at this level. So, and we can see some fatty degenerative changes. That's all in this case. Now, this child did not have any history of ankylosing spondylitis, but also in ankylosing spondylitis, we might see straightening of vertebra, sacroiliitis, and these corner lesions. So that definitely is in the differential. And yeah, thank you.